Hello everybody, welcome back to my channel. I'm here with the wonderful Paloma today. Welcome. Don't forget to check out her channel. Her link will be in the subscription box below.
Hey guys, I feel like we haven't done this in the longest time. Today we have planned something special.
So this past week we asked you guys what you wanted to see, and quite a few of you showed interest in one of our personal projects. You guys are probably very familiar with our medical blogs, but what you guys don't know is that lately we've picked up quite an interesting piece of research.
It all started one day as we were looking through medical journals and we found a particular topic that caught our eye.
And that's basically how we stumbled upon Spina Bifida, isn't it?
What is Spina Bifida?
For those of you that aren't familiar with the topic, Spina Bifida refers to a birth defect in which a developing baby's spinal cord does not develop correctly. Basically, the backbone that protects the spinal cord fails to form and close as it normally should, often leading to physical and intellectual disabilities that range from mild to severe.
How many types are there?
There are 3 types of Spina Bifida: myelomeningocele, Spina Bifida occulta, and meningocele.
I did some research and myelomeningocele is the most serious and the most common. A sac of fluid comes through an opening in the baby's back and the spinal cord and nerves are damaged, causing moderate to severe disabilities.
Spina Bifida occulta is the mildest type of Spina Bifida. It is often referred to as hidden Spina Bifida. With it, there is a small gap in the spine and no opening or sac in the back. It often does not damage the spinal cord or the nerves, therefore it is often not a cause for any disabilities, and is not detected until late childhood or adulthood.
Meningocele refers to a sac of fluid through an opening of the baby's back. But unlike myelomeningocele, meningocele has no nerve or spinal cord damage, causing minor disabilities.
How is it diagnosed?
There are 2 different ways of diagnosing for Spina Bifida. The first method is, during pregnancy, a doctor will perform a screening test to check for any birth defects. The second method is, after birth, a doctor will use an image scanner to check for any abnormalities in a baby's spine. Now that we know what Spina Bifida is and how it is diagnosed, how is it treated?
Well, Paloma, there are 2 ways doctors treat Spina Bifida. When it comes to myelomeningocele and meningocele, doctors will usually perform surgery before the baby is born or shortly after to close any sacs, openings, or gaps. But when it comes to Spina Bifida occulta, doctors will usually use a back brace to help prevent or secure the bones and prevent any symptoms or complications. I have 2 quick questions before we wrap up. Are there any known causes, and can Spina Bifida be prevented?
No one really knows the causes, but they do know many ways to help prevent it. Pregnant women should take folic acid every day, they should avoid overheating their bodies, and they should immediately treat fevers.
Who would have thought Spina Bifida would be so interesting?
Now that we have answered many of your questions, it's time for you to answer one of ours.
How does folic acid prevent Spina Bifida in newborns?
Remember guys, there's always something new to learn. Don't ever stop asking questions. Stay tuned for our next collab.
See you later.